Hi, my name is Viren Mehta. I'm a GP here at Cheadle Medical Practice. I'm also a Clinical Director for Stockport CCG. That's the organisation that buys healthcare services for the residents of Stockport. I'd like to talk to you about Stockport Together. Stockport Together is the partnership between Stockport CCG, Stockport Council, Stepping Hill Hospital and Pennine Care, who's the trust that provides mental health services for Stockport. Recently, this group has been working hard, together with GP practices and other voluntary organisations in the borough, to find ways to bring together health and social care services in a way that hasn't been done before. So why are we doing this? Well, it's recognised that over the coming years, demand for health and social care is going to increase at a rate that will not be matched by funding, leaving us with a problem if we're to continue providing high quality services to the people of Stockport. The plan is to bring together health and social care services in a way that better suits the needs of the people of Stockport by reducing duplication in the system, meaning that people don't have to repeat their stories to different consultants and specialists, and that their health and social care is coordinated to provide the best possible service. And this should also mean that we're being more efficient with how we're using the funding that we have available to us for health and social care. The plans proposed by Stockport Together have been recognised nationally by NHS England, and the borough has been named a Vanguard site. This means that Stockport will receive funding and support from the national team to help us implement our planned changes to improve how health and social care is delivered both locally and nationally. So what does all this mean? The exact details of what this means for the people of Stockport are still being worked through, but what we're aiming to do is to bring together health and social care to support people to live independent, healthy lives. We also want to provide help and guidance to people that need it within the best setting for them, whether that's at home, within the community, at your GP practice, or when needed at the hospital. We haven't got all the answers, which is why we're working with stakeholder groups from the general public and carers, whether formal or informal, to staff at each of the organisations and the voluntary sector to help us understand what does and what doesn't currently work. This will allow us to find out what people need from their health and social care system, and for us to see what we would be able to deliver in an affordable and sustainable way for the future of Stockport. One of our patients in Stockport has her own vision for the future of health and social care, and she's kindly put her words into a poem.
I wave my wand and there appears more of everything save fear and tears. One phone call gets a chance to see the friendly face of my GP. She uses doctor speak to say, I'll sort you out if it takes all day. The pharmacy is what you need. It works a charm and you've not paid. Or if you should need an operation, it's all explained and there's no waiting. A very old lady with childish ambition wants all to be happy and healthy and smiling.